Let's talk about something that doesn't always make headlines, but most definitely should. High blood pressure. High blood pressure is the leading cause of death worldwide. And here's the part most people don't know. Almost 90% of us will develop it sometime in our lifetime. Hi, I'm Dr. Esra Shermadou. I'm a board-certified family medicine and obesity medicine physician. And in this video, we'll talk about why high blood pressure is known as the silent killer, who's at risk, and what we can do to decrease our risk of developing it. So, why is hypertension often called the silent killer? Because it usually develops over time without causing any symptoms. In fact, many people don't know that they have high blood pressure until they develop severe complications like stroke, heart failure, heart attack, or other serious complications. Without causing any symptoms, high blood pressure slowly damages your blood vessels, your brain, heart, and your kidneys over time. In the United States, high blood pressure causes more heart-related deaths than anything else, even more than high cholesterol. Women especially face unique risks. Hormonal changes, stress, and sleep disruption can all affect our numbers. Other risk factors for high blood pressure include obesity, smoking, physical inactivity, consuming alcohol, and increased age. So, what's considered high blood pressure? There are a few guidelines out there with slightly different definitions of blood pressure. But in general, a normal blood pressure is less than 120 over 80. An elevated blood pressure is 120 to 129 over less than 180. Stage 1 hypertension or pre-hypertension is when your systolic blood pressure, which is that top number, is between 130 to 139, and your diastolic or bottom number is between 80 to 89. Stage 2 hypertension is when your blood pressure is greater than 140 or your diastolic is greater than 90. The higher your blood pressure, the greater your risk of heart disease. So now that we've defined what high blood pressure is, how is blood pressure measured? Making sure that your blood pressure is measured correctly is very important. In order to measure it accurately, you want to make sure that you are sitting in a chair with your back supported, not on the exam table. You want to rest for at least 5 minutes before it's taken. You don't want to consume any caffeine or exercise or smoke 30 minutes before. And you want to keep your feet flat and your arms supported at heart level. You also want to make sure that you're using a properly sized cuff, not one that's too big or too small, just right. And you want to try to take 2 readings about 1 minute apart and then just take the average of the 2. At home, you should check your blood pressure in the mornings before your coffee and then in the evenings before dinner. Checking your blood pressure correctly is not only important for diagnosis, but also for making sure that any changes in your medication dosages are appropriately done. Now, before we get into what we can do if our blood pressure is elevated, if you're finding this information useful, don't forget to hit that like button and subscribe so you don't miss any future videos. All right, so you've checked your blood pressure and found out your numbers are a little elevated. Don't panic, but don't ignore it either. Here are a few lifestyle changes that have been shown to help lower blood pressure. Number 1, weight loss. Even 5 to 10 pounds can help lower your blood pressure. Number 2, make dietary changes. Include foods rich in fruits, veggies, low-fat dairy, and whole grains. Number 3, cut sodium. Aim for under 1,500 milligrams per day or start by decreasing your sodium intake by about 1,000 milligrams a day. Number 4, ensure that you have adequate potassium in your diet. These can be found in foods like bananas, beans, and leafy greens. Number 5, move more. Structured exercise is powerful. Start with a daily 10-minute walk if you don't exercise. Number 6, limit alcohol and quit smoking. If high blood pressure is confirmed, medication may be needed, but lifestyle changes are always first line, especially if you have stage 1 hypertension. Lifestyle changes might eliminate the need for medication or reduce the dose or the number of pills needed to control your blood pressure. And remember, when it comes to lifestyle changes, always start with one small change. Add 1 serving of fruits or vegetables to one of your meals. Decrease your intake of fast food or processed foods by 1 meal, or take a 10-minute walk daily. Starting with even just one of these can make a difference in your blood pressure. And once that becomes second nature, you can pick up a second healthy habit. So to recap, hypertension affects most of us eventually. It's often silent, but very serious. Knowing your numbers, checking them the right way, and making small daily changes can drastically improve your long-term health. So make sure you're checking your blood pressure and talk to your doctor if you think it might be elevated. Right, that's it for now. Thanks for watching, and make sure that you share this video with a friend who you think might need to hear this.